Welcome. Today we're going to be working on yoga for hip bursitis. All you'll need is a firm surface to lie down on. You can get down to the floor. If that doesn't work for you, go ahead and lie down on a bed. Make sure you do have some space around you to work. Go ahead and get settled. Lie down on your back with your knees bent and your feet flat. And make sure your feet are about hip width apart, parallel. Let your arms release alongside your body. And when you're working with an area of the body that's inflamed, like hip bursitis, you always want to find the movement that's not increasing the pain that you're experiencing. Try to find a window of comfort in which to work and maintain a nice even breath as you go. Okay, to begin, we're going to be stretching out through the legs. So take your right knee and draw your right knee in towards your chest. Get a hold of your leg under the crease of your leg. I'll be extending the knee joint, but we're going to be moving with the breath. So we're moving slowly. And take a moment, connect to the breath. And then following the breath, as you inhale, extend your knee, extending your foot up towards the ceiling. And as you exhale, bend your knee. Just take a few repetitions to stretch through the back of your leg. Inhale, extend. Exhale, bend. Try to keep the opposite leg stationary, your foot flat on the floor. One more time, extend and bend. And then place your foot down and draw your left knee and get a hold of your leg under the crease of your leg. And as you inhale, extend. As you exhale, bend. Again, your knee does not have to get all the way straight. Work within your own range of motion. What works for you. You do want to feel that there's a stretch, but not too much. Let's try it one more time. Inhale, extend, and exhale, bend. Place your foot down. Okay, now we're going to work in and out of a pelvic tilt. And this is kind of preparation for a variation of a bridge pose that we're going to be working on that's specific to strengthening the glutes, which is very helpful for hip bursitis. So to begin, as you exhale, activate your abdomen, press your back down. As you inhale, release. We're just gently working in and out of the pelvic tilt. Exhale, press down. Inhale, release, tipping, releasing the hips, getting a bit of activation in the glutes, not too much, we're not lifting the hips up. Exhale, press down, inhale, release. Try that one more time. Activate, keep your feet flat, inhale, release. Okay, now we're going to use the pelvic tilt to stabilize the pelvis and then work with the legs. So gently exhale and engage gently into the floor. We're not fully tipping the pelvis, but we're just staying strong and stable through the core, belly, back, pelvic floor. Now take your right knee and just open it out to the side, but not so far that your hips rock. We're just opening that knee out to the side to activate the hip joint, okay? And then draw your knee back to neutral. Place your hands on your hips for a bit of feedback to see if your hips are rocking. So as you inhale, open the left knee out to the side. As you exhale, draw it back to center and switch. Inhale, open. Exhale, center. So we're just getting a bit of engagement into the sides of the thighs, the glutes, the inner thighs. Again, on the left side, inhale, open. Exhale, close. Let's do it one more time on each side. Inhale, open. Exhale, close. One more on the left. Inhale, open. Exhale, closed. Now draw both of your knees in toward your chest. Hug your knees in, gently stretch through the hips in the back. And then place your feet back down. Now from here, we're going to work in that specific bridge pose I mentioned. So from here, as you exhale, activate your abdomen to press your back down. Then activate the glutes. So you're hugging your glutes. You're engaging in the glutes, hugging them towards your spine, the base of your spine. Now open your knees a little bit wider. Okay, and you'll feel that engages the backs of the legs and the glutes a little bit more. Holding that engagement, pick your hips up just a little bit more off of the floor. And you'll feel even more of an engagement through the glutes and the low back. And we're going to lower the hips down, release, and bring the knees back to neutral. And then we'll do that 2 more repetitions. So as you exhale, activate, press your back down, engage in the glutes, hug the base of the spine with the glutes. Then you open your knees a little bit in a wider angle, keeping the feet flat. Now pick your hips up just a little bit off of the floor. So it's just a mini bridge pose, and this different activation through the legs will avoid engaging in the sides of the hips. We're really trying to isolate the glutes. Okay? And then release down. back to neutral. Take a moment to rest. We're going to do that one more time and then hold. So from here, as you exhale, activate, press your back down. Activate the glutes, hug the glutes towards the base of the spine. Open the knees, and then pick your hips up just a little bit off of the floor. Stay active. Don't let go of the engagement in the glutes. That's so important. We want to be really strong in the glutes in the back to help relieve the bursitis in the hips, relieve those muscles that are working so hard in creating that inflammation. Okay, now lower your hips down. Really slowly soften through the hips, legs, and feet. And then from here, extend your legs all the way out. Feet flex, toes up towards the ceiling. And then reach your arms up alongside your head and just stretch out through your whole body, lengthening through both sides equally. Just kind of lengthening out, breathing evenly. And as you exhale, relax, release your arms down. Bend your knees so your feet are flat again. And we're going to do one more stretch here. Very common stretch in yoga, leg cradles. It's also been called like reclined pigeon pose, but we're just going to get a stretch into the hips. But I want you to be very careful if you are sensitive, okay? So from here, take your right leg, cross it over your left with your knee open to the side. Flex your right foot so this right leg is active. Now this may be enough of a stretch. You're going to feel the stretch into the side of the thigh and into the hip. If it's enough, then stay here. If you feel you can, then gently rock your legs from side to side. Doesn't have to be too far or too fast. Take your time. You just want to ease into the stretch here, relieve some of the muscles that we're working, especially in that more intense bridge pose we just did. And then come back to center, uncross your legs. Now cross your left leg over your right, keep your left knee open, flex your left foot. So we're keeping that leg engaged a little bit here, and that will get that stretch into the left hip. Again, if this is enough, stay here. If you can, then gently rock from side to side. Good. It's a really nice stretch after that work we did in the bridge pose. And then come back to the center, uncross your legs. And then once more, draw your knees in. If it's comfortable, hug your knees in. And release down. And then from here, roll to your side and come up to a seated position. And that's all for now. It doesn't take much to get some of the muscles engaged and get a bit of a stretch into the hips to relieve the hip bursitis. I hope this was helpful. If there is anything you have that you'd like to request for me to cover, then please feel free to leave a comment below, and take care. Happy New Year. Namaste.